think it's wonderful to have so many people here sharing what they've done within the NHS and able to share that with the broader NHS community.
Without this type of conference, I don't think the message gets across. The organisation is huge.
I think it's really exciting to bring people from across the country to share their know.
I hadn't realised there was quite so many innovations, electronic innovations that there are, and I've learned a great deal about things you can do.
As you go round the stands, and I've already been round a number of the stands, there are hundreds and hundreds of ideas to improve quality and improve productivity and save resource for the NHS to be reinvested.
It's not only innovation that matters, it's about the adoption of innovation, it's about a health service that takes up those ideas and makes them happen for patients.
Innovation has always been the key to renewing and reinventing the NHS.
It's not the inability to innovate, it's the inability to engage the market, the system, the healthcare system, in the dispersal of that innovation against the forces of anti-change.
So one of the big risks when you come out of surgery is hypothermia, and this is one of the latest inventions. It's a heated gown. Chris, you know all about it. This is big in America, isn't it?
Yeah, absolutely. Pre-warming your patient before surgery in America is kind of the standard, really. In the UK, we very much intraoperatively warm patients. Getting cold during surgery is a really severe consequence of surgery. It's associated with things like surgical site infections, blood loss. All of these have a cost to the NHS. One of the most efficient ways of actually preventing hypothermia is to pre-warm. So you can pre-warm your patient with this for about half an hour before surgery. The patient gets to control it, so they get to keep themselves nice and comfy. You can help reduce those really costly complications, hence save the NHS lots of cash.
So I've managed to find myself a half-naked man. This is John, and you're having an ultrasound. Indeed. You feeling good?
I'm good.
Your heart looks good. Maya, the ultrasound a bit different to anything that's out there?
Yes, it is. Toshiba offer 3D technology for speckle tracking, or we call it wall motion tracking. It means that we can see the heart in a full volume, so we're looking at the heart in 3 dimensions, and primarily we're looking at the function and the structure of the heart in a global capacity and also regionally.
Welcome to the I Neighbourhood House. This house has been specially designed for those in care. And Martin, you're going to show us around?
Come on in.
Okay. So this is the kitchen.
Okay, so what we've got in here is a variety of technologies for use in the home, and this is a rise and fall bench. So for people with disabilities in a wheelchair, you can come up here and you can actually start to move the bench.
Tell us about the bed.
So we've got a sensor in the bed, so if you get up in the middle of the night, it'll turn the light on.
So this is the living room then?
Yes. What we've got set up here is healthcare of the future, and what we've got set up to a TV screen is various devices and sensors. So we've got the usual weight scales, we've got the pulse oximeter, which actually allows you to measure people's oxygen levels.
So I see.
Just take your own reading, and then after a few seconds, everybody gets to know what their own reading is, and it's shown on the television as well. The patient can see their reading compared to previous readings on previous days, so they can monitor how their health is going on an ongoing basis.
So the movers and shakers from health have turned up for this conference, including Jim Easton from the Department of Health. Innovation, how important is it?
Well, there's a reason that there's an I in QUIP, and it's that we know that we can't achieve success in this challenge we're facing of delivering an ever better healthcare system from a pretty tight financial settlement without innovation. And this event today is just a fantastic opportunity for people to get optimistic and positive about the things that already exist, all the things that here are real. You can take them away and do them now to make a difference to patient care and make our NHS sustainable for the years to come.
And this conference has attracted all the big players. And the conference is full of fun innovations, including this surgical robot.
This conference isn't just about keeping people fit and healthy when they're in hospital or in primary care. It's about a lifelong commitment to getting people exercising around the globe as a global initiative, but particularly here in the UK. My company Exercise Works aims to enable every healthcare professional in the UK to deliver safe, effective exercise advice. So every patient, be them in hospital or seeing a practice nurse in GP surgeries. It's about getting the ordinary man on the street exercising and enjoying exercise.
I think it's been brilliant, actually. I have to say there's been a really good atmosphere on the exhibition hall throughout the 2 days. And actually, normal experiences, the people go to seminars, the exhibition hall empties, and then everybody comes out again. Whereas actually there's been a really good buzz about the exhibition. There's a lot of excitement about the changes and some really good conversations. So I think it's been very good. Thoroughly enjoyed it.
This conference has brought together the best in healthcare, allowing them to share the latest technology and new ideas to help improve the health of the nation.